record button's on. Hi, everyone. It's Maria Manriquez, obstetrician gynecologist who's practicing some addiction medicine with pregnant and parenting women here in Phoenix. I am employed by the University of Arizona College of Medicine, Phoenix, and do clinical work at Banner and Valley Wise as well, staffing residents in this topic. Today, we are lucky to have Dr. Michelle Ruha, who is a professor at the University of Arizona College of Medicine. Her primary focus is toxicology, and we'll go into more detail there, Dr. Ruha. And she'll be presenting on the Arizona Opioid Assisted and Referral Line, something that hopefully everyone online knows about, but after this talk today, we will. So thank you again for being here today.
Sure, thanks. Yeah, I was just saying I haven't often been asked to give like fairly short presentation, only 10 minutes. That's unusual. And I thought this was the perfect topic to present in a short amount of time. The Arizona Opioid Assistance and Referral Line has actually been around for a while, but I'm not sure that everyone uses it, even if they do know about it. So this was a good opportunity to share. Now, for some reason, my slide isn't forwarding. Oh, here we go. So first of all, I don't have any conflicts, although I will state that I do work with the Banner Poison Center, which receives calls for the OAR line in Maricopa County. So the objectives for us is to learn about an important resource for patients, providers, and families of persons with opioid use disorder in Arizona, to understand how we can utilize the OAR line as a resource for providers, and also understand how to assist patients with opioid use disorder in their recovery through connection with the OAR line. So one single background slide, because we're all on the phone because we realize that there is a opioid crisis. So we're in the midst of this opioid epidemic. There's increasing numbers of people with opioid use disorder and overdose and deaths, and really insufficient resources to prevent and treat opioid use disorder right now. But we're working to improve this. And there is actually a Arizona Department of Health Services website, the azdhs.gov, has a lot of information on the opioid epidemic, and they have this real-time opioid data available. And I had looked at this, as you can see, it goes to December 2nd. And in this short period of time, from June 15th to December 2nd, they listed 3,760 suspected opioid deaths and over 30,000 opioid overdoses. That, to me, came out to about 35 to 40 opioid overdoses and deaths per day in Arizona. And then I checked it 3 days later, and there was an additional 150, so another 50 per day in those 3 days. So I think that one thing that this doesn't capture is everything else we see. And I wonder, how many people on the line actually see patients, every day or every week for reasons unrelated to overdose, who have opioid use disorder. And as a medical toxicologist working in the inpatient setting, I see plenty of opioid overdoses and deaths, but what I see even more of are the patients with complications from opioid use, such as endocarditis or septic pulmonary emboli, osteomyelitis, et cetera. And also people with withdrawal syndromes that come in for other reasons, or even come in because they've been cut off from their opioids and then go into withdrawal in the hospital. So I think the numbers here reflect only a portion of the problems and patients that we can potentially help. It's really a massive undertaking. So in early 2018, a bill was signed into law for the Arizona Opioid Epidemic Act. And this established a bunch of ways to attack the opioid epidemic, and the link at the top of the slide can take you to this opioid response report on the azdhs.gov site. But there were a lot of different ways that were established to attack the opioid epidemic in Arizona. some of them included education of healthcare providers, others treatment strategies like naloxone dispensing, but one of these was the opioid assistance and referral line. And this OAR line was actually initiated in March of 2018. It's a partnership between the AZ Department of Health Services and the 2 Arizona Poison and Drug Information Centers. We have the Banner Poison Center in Phoenix and the UA College of Pharmacy Poison Center in Tucson, which covers the state. So the collaboration between the 2 and the AZ Department of Health Services established the OAR line. And it's a 24/7, like round the clock free service where anyone really can call in and receive consultation regarding questions related to opioid use and treatment. And this is staffed by nurses and pharmacists, and doctors are on call round the clock to speak with providers who may have questions. This is another website, which is a great resource. It's at the phoenixmed.arizona.edu site. And the Center for Toxicology and Pharmacology Education and Research is a collaboration between the 2 Arizona poison centers. But here, what I really want to draw your attention to is the patient FAQs and the provider FAQs. So in addition to calling the OAR line, there's this website which actually has a ton of useful information on it. So the provider FAQs are really, really useful. They have a link for guidelines, and this is one that is a very common call from providers to the OAR line. People who are confused about the new regulations regarding prescribing. They may not think that you can prescribe a certain amount of opioids, and the OAR line staff are often just sort of clarifying, the new guidelines and regulations, but there's also lots of links to CDC guidelines and SAMHSA, all other types of links on the site. There's also tapering is a big one too. People traditionally have been on very, very high doses of opioids, and doctors are now wanting to taper them down and sometimes need help. And another very common scenario is inheriting a patient who's already on high dose opioids. And this can be really difficult for providers. A doctor retires. A lot of times a doctor loses their license and then somebody else picks up their patient and they don't want to prescribe those high dose opioids that the patient's been on for 20 years. So it can be very difficult because obviously just cutting a patient off from the opioids is not the answer either. So there are help with these FAQs, but there are also things that you can call the OAR line and ask them about. And actually, a recent example, just a couple days ago, I think one of the calls that came in, and this was a great example of how the OAR line might help you, is a physician had a patient who was on buprenorphine, stable on it, and the patient was about to have a surgical procedure. So the physician was calling for some guidance as to what they should do with this buprenorphine. They were planning on discontinuing it and putting the patient on other opioids as a bridge to the surgery, then managing the pain with the other opioids, and then getting them back on the Suboxone later. But actually, through consultation with the physician on the OAR line, it was decided to continue the buprenorphine, and then they discussed options for pain management on top of that stable buprenorphine dose. But there are really like a lot of things that would be beneficial to call the OAR line for. There's also the patient FAQs. So for people who want to go on the OAR line website or call, there's a lot of different information here. What I found to be very interesting is on the patient FAQs, there's this link for a new law on opioids. And I think this would actually be helpful for physicians too. There's a lot of confusion about some of the things that are and are not allowed. And this is actually another reason that the OAR line gets a lot of call from providers. They specifically, they have a little confusion about that like 90 MME kind of cutoff. So you're not supposed to prescribe more than 90 MMEs for like a new opioid prescription. pain, but a lot of people have been on it chronically, and then they sometimes get cut off by their provider who now thinks that's not allowed, but really the regulations don't impact people who are on opioids for chronic pain management like previously. So there's a lot of clarification. It can, but you can also call for this information. So the line is there to help caregivers and patients, and sometimes parents will call because they have concerns about their children with opioid use disorder, or patients themselves will call. They'll try help identifying medical providers. So the OAR line will, see where they live, look at what's available, and can even make phone calls and try to identify people that may be available to treat them. A lot of times they'll refer them to certain clinics, but they can contact the clinic also. And then another thing that they really are very helpful with is transportation. So sometimes people are homeless or don't have, any means of transportation, and they want to be able to get to a methadone clinic or, an addiction clinic where they can get Suboxone prescribed. And the OAR line will actually help, using their insurance information, help them figure out transportation. So this is really a great service. I think, for me, the biggest value of the OAR line is to help me help my patients. So the OAR line can help providers, give them referrals for patient support and outpatient treatment services, referrals for behavioral health treatment services. But I like to use it as an additional layer to connect my patients, with the OAR line so that they have this other resource to help them in their recovery. So when we have inpatients, and this can apply to the outpatient setting also, I like to give the patients as many chances for success as possible. So if I am referring them for outpatient maintenance-assisted or medication-assisted treatment, I'll try and specifically hook them up with a treatment facility. But I usually try and also give them a backup, and then I will also connect them to the OAR line just in case something doesn't work out for them. And the way I do it is I offer the OAR line as a resource to the patients. And obviously, we can give all of our patients the information to call the OAR line themselves, but I try and give them that extra layer by actually having the OAR line call them. So you can verbally consent your patient to give their information to the OAR line staff. And I do this with every single patient I see in the hospital with opioid use disorder. Even if they're not going to go on maintenance therapy and they're just, sort of considering treatment in the future, I ask them if I can connect them with this resource that's there to help them, and that staff from the OAR line would call them once they're, out of the hospital and see if that they can help them get into treatment facility or, see how they're doing. And almost everyone gives verbal consent. Almost everyone I've spoken to wants that or is appreciative of that opportunity. And then I actually ask them for their phone number. So they give verbal consent. They give me the best contact number. A lot of times it has to be a family's phone number, or they'll say, well, you can call my mother. I don't have a phone. And then I give the number to the Poison Center along with, the OAR line, but again, it's through the Poison Center. And I'll give them the patient's name, their contact number, what the issue is, like specifically, hey, can you check on this person, see if they're getting into this clinic or this treatment, or help them get into one. They're going to have problems with transportation. And then the OAR line staff will provide at least 2 follow-up calls to that patient to offer assistance. Now, even though I've had like 99% of people at least consent, and I've been able to give their contact info to the OAR line, when I follow up, it's a smaller percentage of patients who accept that later. But I think that that's what we encounter in general with opioid use disorder. Only a fraction are going to follow through and use the help you give, but it's like another layer. So here's just one quick example. If you have a patient, say, who presents to your office with a problem related to opioid use disorder and they're interested in MAT, but you are not a prescriber. You can't prescribe buprenorphine. Obviously, no one can prescribe methadone outside of a methadone clinic. So you really want to connect them to care, but you're unfamiliar with the resources that are available. Maybe you know an office and you call it and it's completely booked out for 2 months, or maybe they don't take the patient's insurance. So you can call the OAR line and they can help you identify some treatment options for that patient. And if you ask the patient, to give verbal consent, you can give their information to the OAR line staff, and then they will also follow up with that patient and help them connect to treatment. So it's a really great service. So just to summarize, I think that it's a good practice to maybe have a document that has the OAR line information that you distribute to all of your patients with any risk factors for opioid use disorder. That way, if they're, at some point where they decide they're looking for help, even if maybe they weren't ready for it when they were with you, they have that number, they have the information, they can go to the website. And if they will consent, then I would give their number to the OAR line and have them check on them after they've left your care. So that's my brief presentation of the OAR